Well, good evening, everyone. SOPHE, National SOPHE, and our chapter members, and greetings to you as we welcome you to this SOPHE all-member town hall on a very important topic this evening, COVID-19. My name is Elaine Alden. On behalf of the Board of Trustees, the House of Delegates, of the SOPHE staff, and our leaders, it's my pleasure to welcome you to this evening's event. We really sincerely thank you for taking the time after your busy workday today to join us this evening. Ever since early March, or earlier this year, when it was clear that COVID-19 and the COVID pandemic was going to dramatically impact the public's health, our SOPHE leaders have strived to keep you, our members, and your work on the front lines in serving and responding to your needs. Tonight, it is our opportunity to listen and to learn from you how the pandemic has impacted your work on the front lines and what we can do as your #1 resource for health education to respond to your needs. I have just a few town hall housekeeping messages to share with you before I turn it over to tonight's moderator. First, those of you who cannot connect by video or online by computer have the option to use audio and the telephone dial-in number on your that's available to you. All participants at this point, except the moderator and myself, are going to be muted for the first few minutes. But later, our breakout sessions will allow all participants to mute and unmute so you can join the discussion. We're also recording this evening's town hall meeting, and it will be available on the SOPHE YouTube channel within 1 week. That is this main part of the conversation that we're having. The individual breakout sessions will not be recorded. You can speak freely, and we'll be taking notes to be sure that we capture all your important comments. These comments from the breakout sessions will be provided for all our SOPHE members on our website within 2 weeks. At any time during tonight's event, you can submit questions during this town hall by typing into the Q&A box that's available on your screen, usually at the bottom of your screen. And now it's my pleasure and honor to present the dais here to your SOPHE president for 2021, Dr. Kam Escofri. Kam is a professor and vice chair in the Department of Behavioral, Social, and Health Education Sciences at Emory Rollins School of Public Health in Atlanta. Good evening, Kam, and take it from here for our SOPHE Town Hall.
Great, welcome everybody. It's my pleasure to welcome you to our virtual town hall meeting. As Elaine said, we are excited as a board to come and listen to you and see how SOPHE can be of help in your day-to-day life. Elaine, I'm going to have to ask you to help me for the slides. So next slide, please. So as Elaine mentioned, the purpose of tonight's town hall, I think this is our first town hall virtually after our annual business meeting at the virtual conference. So we are doing a lot of firsts this year, but we want to be able to get a brief update of what's happening at the SOPHE's office in terms of our activities to help you respond to the COVID-19. And more importantly, we want to hear from you. So we're asking you to give us insights on how we can address SOPHE activities and also resources to steer them towards how we can address things that you're experiencing in your day-to-day life. And so the 2 questions that you'll see at the bottom are what our breakout sessions are going to be covering. 1, what is your biggest professional challenge due to COVID-19? What challenges do you anticipate happening so that we can kind of gear our resources together to help you as best we can? And then secondly, what resources, whether they be fact sheets or other things, can also be of assistance in terms of what we can provide to help you handle the day-to-day pressures of working in this time of COVID-19. Next slide. So I wanted to give you a brief overview of tonight's town hall agenda. You will get a really brief overview of what SOPHE is doing at the National Office to help with COVID-19 activities. We're mainly wanting to hear from you. So as part of this breakout sessions, we'll be listening to you and have you be in rooms with 8 to 12 other SOPHE members, and we will have it moderated by our SOPHE Board of Trustee members and also SOPHE staff. So thank you everybody for joining us in this evening to be able to do that. Then we're going to bring it back together at around 7:50. We're going to come back and hear from some of the breakout groups and also have a Q&A session, and then we'll close it out from there. Next slide. So first we want to start off with all of our students. We are really excited to have a lot of resources on SOPHE's website for the students. We have a curated collection for students, and through this session you can also see the QR code here. But this is at your fingertips for things such as how to write a resume, how to look for jobs, mentoring opportunities. And you could check out a lot of these tools at SOPHE's new Career Hub. And we also encourage students to check those resources out. One other thing that we were able to do as a result of the 2020 conference going virtual was to give students access to the SOPHE's chapters. And so we have alerted all of the various SOPHE chapters of students who are in their areas, and students can be able to participate in not only SOPHE activities at the national level, but also the local activities, whether they be webinars, professional development activities, and chapter events. So we encourage you to do that. And the last thing is we are sensitive that this is a very important and also a time where there might be hardships due to a variety of reasons, whether it's our families or people that we know. So we are making some accommodations in terms of memberships and listening to members who might need a little bit of assistance at this time. Next slide. And then for another group of SOPHE members who are also really important at this time are faculty or trainers or people who work in workforce development. As you know, we have pivoted to a lot of virtual teaching. We were just talking about that as a board. Some of us are teaching and talking about what our universities are doing in the summer and the fall. And so if you are going virtual, we have some great resources in one of our premier journals, Pedagogy and Health Promotion. And there's some sets around online teaching for those in the academic setting, and also sets of articles for doing online learning for the public health workforce. And you can access it through this link here, but they have also are on SOPHE's website. And then we just want to remind you of some of our larger events. So first I'll start off with the SOPHE annual meeting. As you remember, we went to a virtual meeting in March, and we were able to record over 50 presentations and almost have 60 CEU hours, so that you can also get some of the content on demand if you weren't able to attend all sessions or even attend some sessions. So we will include those for you as SOPHE members. If you're looking for professional development activities as well. And some of the topics, for those of you who remember, were around COVID risk communications, health equity, and a few more things, but some timely issues and topics related to the topic that we're going to discuss tonight. Next slide. And of course, we just had, not too long ago, our Digital Media and Health Summit. This was our third annual summit, and we were able to offer around 10 continuing education contact hours. With the sessions, we had keynote speakers. We also had breakout rooms, and you could see that we kind of experimented with more things such as blogs and other resource handouts that you'll have access to. The recorded sessions will be available soon to all of you. to be able to access, and we will have discounts for SOPHE members as well. And then our upcoming Health Advocacy Summit is happening this October. This is our 22nd annual Advocacy Summit, and I know it's on a topic that we started at the annual meeting, the impact of climate on health. There will be a lot of different sessions, and you can see that it's going to be on a Tuesday, Wednesday, and in the middle of the day to accommodate our members on the West Coast from 12 to 5. And we anticipate offering at least 10 to 15 hours. So please come and make yourself available of this very important topic. We do have opportunities still available for scholarships, both for students and practitioners. You can see that we have $400 to offer you. So if you're interested in going and need the assistance for applying, we encourage you to apply by July 13th. We have 14 slots for student scholarships and also 6 practitioner slots. We're excited about having both types of scholarships available. And we know that this is critically important. As you know, public health is at the forefront of the pandemic response. And some of you I know on the line are helping with that. And so we need to continue to advocate not only for climate health, but also for appropriations and funds to go to public health organizations and agencies at the federal, state, and local level to address COVID. Lastly, I want to just to highlight some resources that are upcoming, and I am so excited about the way that SOPHE is offering professional development and also turning the journals into great areas of resources. So these are some examples of them, but you will see that there are more to come. So Health Promotion Practice, one of our practice journal, is going to be sharing a blog of members and highlighting their experiences with addressing COVID and whatever roles that they play. So I think that's great in terms of being able to highlight our stories of health education practitioners in action. We have a lot of upcoming webinars. So in CORE, we have updates and impact on African Americans and vulnerable populations. That was a really heavily attended webinar, so that's something not to miss if you want to go and review that. We also have a upcoming summer series on navigating through health inequities during the COVID pandemic, and you can see that we have a couple focus on Latino and Hispanic health. That's upcoming Wednesday, July the 8th at 2 p.m. Eastern. And then we also have one on health equity among children and family on Tuesday, July 21st. Our second large journal, Health Education and Behavior, is also providing some open access collections to our members around the topic of COVID. And I've enjoyed reading some of the commentaries and other articles that have come out, and Jesus has done a great job about posting them and making them available through social media. For all of us who are trying to wrap our heads around coming back this fall, we're going to have some sessions for faculty in terms of how to help with planning for becoming or returning to campus virtually or on campus physically. So stay tuned for that. And we're also trying to work on how we can promote the role of health education specialists and health educators in the time of COVID. And so I know some of us have been getting together and thinking about how to showcase that a little bit more. Please stay tuned to all of those on the SOPHE calendar for more details. And now I'm going to quickly go into our town hall guidelines. This is our time to listen to you and get what you need at this time. So we're going to break out, as we said, and spend about 35 minutes together in the breakout rooms. You'll have SOPHE board members guiding and the conversation, and we'll also have staff helping to take notes of the comments. And we appreciate that you're here. And I know this is a hard time, but we love for you to be able to introduce yourself and share your thoughts. Please take time to speak freely, but also have time for other people to participate as well. And we are going to be doing what we call aggregate summarization of the comments. So we're not going to attribute to anybody in the breakout rooms. If possible, we would love you to turn on your video. That just helps set the kind of community a little bit more, if you can. And please take time to just listen to each other, but also share. We ask that before you speak out, just introduce yourself so members will get to know each other. Tell us your name, who you're affiliated with or what organization, and also your job title. And we also ask that you just be a little bit courteous and allow everybody a chance to speak, and then share additional thoughts if you want to. We will also be able to get some information from each other if you want to share some things via the chat. You can do that, and we can also let you stay in touch with others who are in the chat with you if you want to have that conversation. And Maricela, who is our Director of Professional Development, email is right there, and she can facilitate that. And at the end, this is our first virtual town hall. We want to know how it's going. We have thoughts for others in the future, so please complete the evaluation. So thank you very much, and we're going to be putting you into breakout rooms right now.
Would you like to show the next slide of the breakout room discussion questions?
Yeah, so these are the discussion questions that I mentioned before. So we asked you to think about what are your biggest professional challenge during this time? What do you anticipate as challenges for the next coming months? And then secondly, what resources, webinars, fact sheets, or other types of materials can we offer as technical assistance to you in handling our COVID-19?
Great, thank you, Com. This is Maricela, and I am going to go ahead and move you into your breakout session rooms right now for approximately 35 minutes. You will see the timer on your screen, and it will take about 10 seconds for the transition.
Thank you all. I think most people are coming back. I see a flash on the screen. I love this view. Get to see everybody. I want to thank the board members and you all for participating tonight and giving us a chance to hear from you. Now with a few minutes left, we'd like to invite 3 of the breakout groups to share with us what were some of the things discussed around the 2 main questions that we had for you. And if we have time, we'll also invite you to either type question in the Q&A box, and then we have some last remarks. So I want to invite 3 of our scribes from the breakout rooms to share what you heard from our 2 questions. So I'll start with Heather.
Absolutely. Yeah, I think I'm just doing this vocally, correct? Because you've got the slide, the questions up. Okay, great. So we had a wonderful conversation. I was with Lillian and Dr. Fortune. I was with Dr. Parks and also Aday from Jackson State. And so really when talking about some of the issues with question 1, what are the biggest challenges? I think the academicians really felt like that engagement of the classroom was tough to wrap their hands around. Students just, you know, they might put out a question or a poll and there's just not the same kind of organic kind of conversation that normally would happen. And so that was a big challenge. I think, and this is probably for everyone, some repetitive comments over just workload and burnout and prioritization. I mean, we've got families, we've got other things going on, and many of us are working in the home front. So when do you turn off? How do you switch gears? What defines your working hours? I mean, I think so much of that is speaking to everyone right now. And and even the students. I know Ade was a student too, and so she's talking about from the students' perspective, it's like, how do you turn off? Because if you have more discussion boards, if you have more things being provided to you as tools, then sometimes that's really overwhelming for the student as well. And then I think for that second question, a couple of opportunities for SOPHE. They discussed that on that same topic of that organic discussion, maybe doing a webinar or having a discussion on what can we look at for ways to engage, different opportunities to do that, and maybe what systems aren't being utilized or models aren't being utilized currently that would be new ideas to try as we go into maybe summer or fall session virtually. I know Dr. Parks mentioned time management, but I feel like maybe that wasn't exactly the right word. She really was thinking about how do we look at what the priorities are and the way to get whatever a productive result is, because I think the idea of productivity right now is confusing. We're trying to figure out what does that actually look like and what does that mean when you know you have tasks that are due, but then how do you know if you're doing them in the right order and some of these other things. So I think tools around those concepts. And then we talked a little bit about health literacy, and we can expand more on that for sure. But I think Dr. Fortune really highlighted the ideas of even talking with her dad and going to doctor's appointments and being around people in the community. And what does that look like? What does that look like on the levels of how you understand the information, whether or not it's accurate, but how you understand it? And then also, how do people in school health, for example, convey that to people that they are then going to teach as a health educator? How do you speak to the K-12? How do you speak to the collegiate students? Sort of these other tiers and levels of health communications. So that's kind of what came out of our discussion.
Thank you so much, Heather. I'm going to invite either Antoinette or Zebly to present.
Hi, this is Antoinette. Oh, go ahead, Zebly. Go ahead.
Sure. I was in group 3 with Antonio, Caitlin, and company. And a lot of the current challenges, similar to what Heather was saying about information overload and bombardment with a bunch of resources, is that is they're feeling a lot of that fatigue, but also they feel we swing a lot between helplessness and helpfulness day to day, week to week. And a lot of the current challenges are helping clients with their needs, with so many closures and layoffs of a lot of the benefits maybe that their clients are receiving aren't enough. And so, some upcoming challenges that they foresee arising are finding ways to use their voice to advocate for resources that can help. And so some of the resources that we talked about was having SOPHE give members the tools to kind of start their own grassroots advocacy efforts, sort of bottom up. And, there's different ways we can do that with town halls just like this, focus groups, and being able to share resources, and so that they know that they don't have to do everything themselves. I mean, if other people have something other organizations have something that they specialize in, we can share that with them, and then they can take that to, advocate for themselves, and then just spread that around, and perhaps forums that members can share to say, this is what's been useful here. Maybe you could try that down on your end. So that's just, a lot was said, just like Heather said, we had a great session. We had a really wide perspective, people coming from different areas. But that's just a summary of what really the focus was on, advocacy and how they can make grassroots efforts. So yeah.
Great, thank you. Very important that advocacy, that touch upon, just like health literacy, I think all important issues for health education. Antoinette.
Thanks, Com. Thank you, Heather and Zebly, for reporting out. In my session, we had all academics, all who teach in higher education. So it was interesting to really hear similarities, but some differences were found. So in a couple states, and all were in different states, by the way, or are in different states. So in some states, masks are mandated, but of course we can't necessarily police who is wearing a mask and who isn't, but what can we do to better serve by providing maybe a one pager that says wear a mask, and this is why it's good to wear a mask. A lot of student resources were brought up, things that SOPHE could do, building student resources. So I do know we have a student curated collection. However, maybe making free access to student access to other resources might be something down the road. There was the issue of learning due to a quick transition to virtual. The flexibility and the access to different software, and then the having a professor and or student be comfortable using certain softwares. Maybe you have introverts to extroverts, and so there is mental health brought up a lot, just not only from students but also professionally speaking. Public health departments right now are being asked to be contact tracers, talk to students, who have you talked to, who have you hung out with. There is the need to build resources to say, keep social distancing. And what does that look like when we can't exactly see what students are doing outside of the classroom? Why is that brought up? Well, some campuses are asking students and faculty to come to campus this fall. So needing those kind of resources to share and disseminate amongst others on campus is very important. And public health departments and the faculty are asked to be on task force, something that maybe they never expected, but they're being asked to build these resources. So there is that need and assistance that they're asking of SOPHE. And then also public health ambassadors was a solution to helping build these resources. I also brought up the collegiate champions and maybe looking into what can we do to convert their current tasks with assisting SOPHE staff with building those resources. And then before ending, social marketing materials, what can we share with them? What does that look like? Is it membership only, or is this a public resource that we can offer? We did discuss the SOPHE faculty forum, which I believe is a part of the COP, and being sure that we're adding to that. And then understanding that that is a membership benefit. And then skill building was also brought up. How do we advocate on hot topics, bigger issues such as racism is a public health issue. Some might not think that, but we feel strongly that it is. And then how do we share information, resources to be anti-racist? And one thing was brought up, how to make hand sanitizer. I don't know, maybe that is something, a resource that we should create to share on campus. And I think that's all I'll share for now. Thank you.
Thank you very much. Well, I really appreciate the report outs. We will gather the information and think about what are appropriate next steps. True to all of you being health educators, it was wonderful to not only hear your challenges, but also see some of you come up with solutions in your breakout room. So I really appreciate that. So I'd like to go to the next slide to wrap up. If you have any other questions or things that you didn't get to, feel free to reach out to me via email or to SOPHE's office. We just wanted to draw your attention to a few things as we wrap up. You will see here that we have nominations open for the 2021-2022 officers. If you have experience in SOPHE and are interested in moving to the next level, we always, as you have seen, some board members participating and facilitating the town hall breakout rooms. We're interested in new leaders and who are committed to health promotion and critical to the success of SOPHE and also the profession. We'd like you to step up. These are the 8 positions that are open. All of them are for 2-year terms, except for the student trustee and also the president-elect position. If you're interested, we ask you to contact Dr. Antonio Gardner, and his information is right here for you. We also suggest that if you want any resources for health education, that you can visit the SOPHE store. You can see here there's a community engagement and other tools of the trade that are available, as well as SOPHE merchandise, and they're all available to SOPHE members at a discount. And then, of course, I think this went well. You never know with technology when you do these things, how it's going to go. Thank you, SOPHE staff and Elaine, for making this go off without a hitch. But we'd like to get your thoughts on this town hall. Please, well, you'll see the evaluation being sent out to you. Complete the evaluation. Let us know your thoughts, what went well with it, so we can also think about this and strengthen future town halls. And speaking of which, stay tuned. We are thinking and planning for a health equity and racism elimination town hall coming soon. We have our task force under the leadership of our past president, Jean Rennie, who are going to be coming up with a way to listen and also maybe do some of the same discussions around how we can help each other to kind of address racism and also address health disparities in this time of COVID. So thank you very much for coming. And on behalf of SOPHE board and staff, we hope that you stay safe and healthy. Thank you for spending your evening with us and sharing some thoughts, and we will gather all the information and think about some next steps. So we appreciate you all coming. It's nice to see all of you.